Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. We've designed our curricula to elevate your confidence in this specialized field. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Again, secondary signs, let's take a look. These were written up in this wonderful paper, this landmark paper in the use of MR imaging by Schweitzer and Donovan. I encourage you to check out all the writings by these authors. Pressure point, T1 marrow infiltration of the soft tissues on this transaxial short axis view of the forefoot. And here we can see adventitial bursitis. So in the case where we begin to have a situation where we alter our weight bearing, in Charcot arthropathy, we begin to offload areas that are causing us pain. And in this case, we can see on this sagittal view through the hindfoot, the talus relative to the cuneiforms and metatarsals is plantarly subluxed. And that's the situation that occurs in Charcot neuroosteoarthropathy. And what first can be shown is that there's a blister occurring at the soft tissues in the area where there's increased pressure secondary to hindfoot supination. And when the blister opens, of course, that will be a source of ingress of infection and can cause cuboid osteomyelitis, very common. This is a nice example along the plantar aspect of the great toe, showing the flexor tendon and enhancement along that flexor tendon, denoting septic tenosynovitis. Notice the large ulcer that's penetrating along the lateral border of the great toe pulp. Here we can see on this MRI, to define the extent of infection, we see that we have a soft tissue ulcer where the arrows are pointing to and the T1 marrow infiltration of the soft tissue. Now we have to decide what's going on at the plantar aspect of the calcaneus. Of course, this is the calcaneus, the sustentaculum talar portion of the calcaneus. This is the talus, the medial side, the medial malleolus. And what we're seeing in this region is that on post-contrast imaging, we have a lot more going on here than meets the eye. And in fact, this is a rim-enhancing soft tissue abscess contiguous with the ulcer. And here we can see on that transaxial image how that large abscess is draining right out through the ulcer. And of course, we can see this enhancement of the calcaneus in this area that we had the suspicion of T1 change in a patient with osteomyelitis and abscess. In wet gangrene, we can see the effect of gas or emphysema in the soft tissue by the susceptibility artifacts that are created along the example of the tendon here. On this long axial coronal image, we can see that along the plantar fascia and the flexor bands, this soft tissue change, this low signal change on T1 weighted images, low signal on all T1 and T2 weighted images is gas. And we can see that septic tenosynovitis example in this patient who has wet gangrene. When we're looking at the MRI for neuropathy versus osteomyelitis, again, in neuropathy, what we can see is that there's this subchondral periarticular change or polyarticular without an ulcer. And it's more common to be in the areas that are affected in Chopard and in Lisfranc. More than 85% of patients present with these areas, that it's either involving the midfoot or the hindfoot. And of course, in osteomyelitis, we're going to be applying those same principles. We'll be looking for T1 marrow infiltration, and we'll be looking for those secondary signs, of course, skin ulcer, cellulitis, abscess, or even sinus tracts. And that's located even distal to the tarsometatarsal joints, calcaneus and malleoli, anywhere there's pressure. If there's an ulcer, we want to perform an MRI to evaluate the extent of the disease. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.